So here we're going to learn the neuroanatomy of cognition. We talk about memory in detail in the limbic system session where we talk about the PAPE circuit. In the tutorials in this subject, we talk about the psychology of memory, its classes and capacity. But in this video here, we're going to focus on language disorders and apraxia and neglect. We've talked a lot about the language centers. Broca's area is the motor center, the speech output area, and then Wernicke's is the language comprehension area. We talked about the fact that Broca's area is in this inferior frontal gyrus here, and that a Broca's aphasia is a non-fluent aphasia, meaning that the person is able to understand what's being said to them, but they're unable to produce language, either written or oral. Wernicke's area is in this posterior superior temporal gyrus. This is a sensory aphasia, meaning that the patient is unable to comprehend language. They're able to produce language that is fluent, has melody, prosody, but it's word salad, it's nonsensical. They can't understand what's being said, and they can't produce language that makes sense either. Now we can get into further nuance of aphasias, and we can use repetition as a way to distinguish different classes of aphasias. Repetition is we ask a patient to say something and they're unable to repeat it. In Broca's and Wernicke's, repetition is impaired as well as global. Global is, we can think of as a combined Broca's and Wernicke's, meaning all aspects of language are impaired. And then there's also something called a conduction aphasia, in which repetition is the only thing that's affected. Motor and sensory are intact, but repetition is impaired. And then if repetition is intact, but we have motor output problems or sensory reception problems, we have a transcortical motor or transcortical sensory aphasia, and then a mixed transcortical we can think of as a global, except that repetition is actually intact. So let's talk about apraxias and neglect. So for apraxia, think of an inability to perform an action despite the fact that all of the neurological underpinnings are still intact, and think of it as a left brain injury. For hemispatial neglect, think of a lack of regard for and an inability to pay attention to the contralateral side of the body, and think of it as a right brain injury. So now let's look at the apraxias and their localization. First, limb kinetic apraxia, premotor cortex. Think of this as an inability to perform finely graded motor movements such as playing the piano. Next, inferior frontal gyrus region. Think of speech apraxia. So if you don't have a Broca's aphasia, but you have a slowing and incoordination of speech, think of a speech apraxia in that general inferior frontal area. Posterior apraxias. First, optic ataxia. This is an inability to reach out to objects that are able to be visualized. This is part of Balint's syndrome, which has optic ataxia, gaze apraxia, which is an inability to shift to different objects, visually shift to different objects, and then simultagnosia. And the easiest way to think of simultagnosia is you can feel when someone touches you on either side of the body, but if they touch you at the same time on both sides, you're unable to perceive one side or the other. And think of this as a superior parietal lobule injury. In the inferior parietal lobule, we have ideomotor and then ideational. And the way to think of ideomotor is you tell someone the command you want them to perform, but they're unable to perform it. So they're unable to respond to a verbal command. Ideational, think of you ask them to show you the steps of mailing a letter, a complex task, something that requires multiple different steps, and they're unable to conceptualize how to do that. Finally, Gerstmann syndrome, think of angular gyrus, multiple different things here. Left-right disorientation, finger agnosia, which is an inability to perceive fingers, either your own or the examiner's. Dyscalculia, an inability to make sense of arithmetic, and then dysgraphia, an inability to write. Finally, let's look at neglect. So hemispatial neglect, it can be mild, meaning that there's simultagnosia maybe only, and we talked about this, double simultaneous stimulation, patients unable to perceive the opposite side. Or it's severe, in which they're unable to attend to that half of the world entirely, to the point where they may have anosognosia, an unawareness of the deficit. They may not be able to move that side of the body, but they don't even know it. Autotopagnosia is an unawareness of one's own body parts. So they can't, so if you hold up their arm and you show it to them, they'll deny that it's their own. They'll say that it's the examiner's. So even visualizing it, they still aren't aware that it's part of them. And then there's something called Anton syndrome, which is a denial of one's own blindness. So it's a posterior occipital region, because that's where vision is, but it involves the awareness center, so it's a denial of one's own blindness. So that's a quick trip through some high-yield topics in neurocognition.